mynews.studio.
Picture a single worm, about a meter long, slowly emerging from a child's leg. That was once a common scene. Today, only 10 cases of guinea worm remain worldwide. How did we actually get so close to wiping it out?
Let's put some numbers to it. Since today is February 24th, 2026. Back in 1986, guinea worm disease affected 3.5 million people each year across 21 countries. Fast forward to last year, 2025, and there were just 10 known human infections. That's a reduction of more than 99.99%.
And all that, without a vaccine or a medicine to cure it. People survived and avoided infection only through prevention. This is where President Carter's Carter Center stepped in, working with ministries of health, UNICEF, WHO, and the CDC. Their methods were simple. Put filters on water pots, give pipe filters to nomads, treat ponds with larvicide, and dig new boreholes for safe water.
Right, and beyond that, they created huge volunteer networks. Local people were trained to identify cases, help isolate patients, and do things like bury fish guts. Just to clarify, why fish guts?
Good catch. The guinea worm larvae actually develop inside small water creatures, which can end up in fish. If dogs or people eat fish guts that have the larva, the cycle continues.
So that's why managing fish waste became important. But there's another twist. In 2012, researchers found that dogs in Chad were getting infected too. Suddenly, it wasn't just about people drinking contaminated water. The parasite had a new animal host.
Exactly. Once dogs were involved, the strategy had to change. It wasn't enough to block infection in humans. Now, programs started rewarding people for reporting infected animals. Volunteers learned to tether dogs, treat ponds where dogs drank with larvicide, and bury fish scraps so dogs couldn't eat them.
So this was a real shift. Now the focus was on both people and animals. Did these new approaches actually slow the progress?
They did. Human cases didn't drop quite as quickly once dogs were added to the picture. But with thousands of volunteers teaching wound care, reporting every case, and mapping risk areas, the disease kept shrinking, just not as dramatically.
Education must have played a big part alongside all those technical interventions. Was it as important as the filters and chemicals?
Absolutely. Volunteers taught people to avoid unsafe water and to keep infected wounds away from ponds or wells. It became a shared community responsibility. Plus, some villages got rewards, like new wells or supplies, for reporting cases. That kept everyone invested.
But there were still challenges, especially in places like Mali and South Sudan. Civil unrest made it hard to reach some areas. Do we have any idea if there are undetected cases hiding there?
Surveillance gaps are still a real problem. Some regions are just too dangerous to access, so it's possible cases aren't being reported. That's one reason the goal is 0 cases by 2030. But it depends on better surveillance, more health workers, and tight coordination with international and local partners.
And the definition of eradication has changed too, hasn't it? Now the WHO says animal cases count as much as human ones.
Exactly. For guinea worm to be declared eradicated, there can't be ongoing transmission in humans or animals. That's a higher bar than before, and it means surveillance has to be watertight.
After so many years, what can we learn from this? Can the guinea worm campaign serve as a model for other disease programs?
It can. The mix of community education, incentives, and a One Health approach, seeing animal and human health as connected, could help in other efforts like fighting polio or neglected tropical diseases. The guinea worm campaign shows what's possible when local communities, governments, and international groups work together over decades.
President Carter's Carter Center played a major role here. It's rare to see a disease brought this close to 0, especially without a vaccine or medicine.
And it's a reminder that the last stretch, the so-called last mile, is often the hardest. The emergence of animal reservoirs was unexpected, but the teams adapted and kept the goal in sight.
So could guinea worm be the next disease after smallpox to be eradicated from Earth? That's the challenge for 2030.
Thanks for listening. This episode was powered by mynews.studio. You can try it now for free.